So my name is Dr Resham Baruah. I am a consultant cardiologist working at Chelsea and Westminster NHS Foundation Trust. I also work at the Brompton Hospital and Harefield Hospital. My specialist interests are in heart failure and imaging, but I like seeing patients with a wide range of cardiology conditions. So valvular heart disease is a common condition affecting a wide proportion of the population. We all have 4 valves within our hearts, 2 on the right side of the heart, and the right side of the heart is the side that pumps blood to the lungs, and 2 on the left side of the heart, which is the side of the heart that pumps blood to the body. The way I like to think of it is these are like doorways within the heart, and they make sure that the blood goes in the right direction. So when you have a problem with these valves, it's either because the valve is narrowed, so it's harder for blood to get through, or the valve is leaking and some of the blood starts going backwards. The symptoms of valve disease can be very variable. Some people have no symptoms at all and are just picked up on a health check, perhaps if their doctors listened to their heart and heard what's called a murmur within the heart. But for other people, the symptoms can be things such as breathlessness, palpitations, chest discomfort, swelling of the ankles. And if you do get any of these symptoms, it is worth getting these symptoms checked out. The diagnosis of heart valve disease is predicated upon echocardiography. What's that? It's an ultrasound of the heart, very similar to the scans that pregnant women get. It shows us the structure and the function of the valves, and it doesn't involve any ionizing radiation. An echo scan can take somewhere between half an hour to an hour to perform. And these are in-depth scans that tell us about how the valve is functioning and the consequences on the rest of the heart. The treatment options for valve disease really depend on how severe the valve disease is and how many valves are affected and what by. If people don't have symptoms and the disease is very mild, then often it's a case of just monitoring to make sure things do not deteriorate over time. As things get worse, it may be that we want to introduce medications to help support the heart, perhaps lower the blood pressure. And then as things may deteriorate over time, we may consider other interventions such as surgery. So this is the key question. So we all can take control of our lifestyle, and there are lots of things we can all do. So eat healthily, lots of fresh fruit, vegetables, legumes, pulses, oats and oily fish are really good for the heart. The other things we can do are exercise, make sure we're doing 20 to 30 minutes, at least 5 times a week of cardiovascular exercise. What else can we do? Try and minimize the stress, work on our mindfulness, make sure that we're working on connections. Social connectivity is really important for heart health and making sure you don't get isolated. Drinking in moderation, and of course, please stop smoking if you are a smoker.